Hello and welcome to Reframe's latest webinar. I'm glad you can join us today. What we're doing today is looking at the research results that we've previously carried out. This is a research study that looked at living with cancer, the experiences that people are feeling both working with and living with cancer, the employee experience survey. Today with me, I have Mark Stevenson and Kate Higgins, two panelists for this webinar who will give some insight and thoughts on the findings and hopefully some really practical and helpful insights as to how it might be used back in your workplace in an employee environment. So I'll just quickly go screen. So Mark, if I can just ask you to introduce yourself, please.
Thanks, Sean. I'm really looking forward to going through some of the data and details we've got here. Yes, a quick introduction to me. I've spent the last 20 years of my career in healthcare, running healthcare businesses. I suppose what's pertinent about today, I've spent almost 2 years now at Reframe Cancer.
Thank you. And Kate, welcome to the webinar. Nice to have you with us. If you'd like to just introduce yourself, please, that'd be helpful.
Oh, thank you very much for inviting me today. My name is Kate Higgins. I've worked in HR for about 25 years in various industries, including financial services, healthcare, distribution, and comms. I have experience, sadly, in supporting a variety of different employee needs during their experiences with cancer and the teams that they work in. So I hope I can bring some real life experiences to our session today.
Thank you, Kate. Thanks for being with us. Okay, so today we've got lots to cover. There's lots of themes that were pulled up through the research. As you can see there, there's a range of things in terms of absence and how long people were off during their cancer journey at different stages. We'll pick up about communication and how quickly, or perhaps how not quickly, the employees communicated the challenges they were facing during their cancer journey to their employers. We'll look at healthcare, private healthcare, and who's getting that type of care, and also employee benefits and whether those benefits are up for the task of sort of supporting an individual as they go through a cancer journey. But hopefully we'll give you some really useful tips, guidance, and help that you can use back in the workplace. So I think perhaps Mark, if you just give us a little bit of an overview as to why you were the architect behind this survey. You felt it was important. Give us a feel for why this is important and why cancer in workplace is something that perhaps is understudied to some extent.
Yeah, I think that's a really good point, Sean. There has been studies done before in the workplace of the impacts of cancer, but I don't think in the level of detail that we've gone into here. And also, we don't feel that some of the previous surveys that have been done, they're quite old now, were a proper cross-section of society. I think what's really good about the survey that we've done here, as you can see, we've got a really good cross-section of ethnicity, of gender, but also of age. Really important to get that. And also, not just people who are on PMI, we've got a real cross-section of people that are lower down the pecking order, right up to people on the C-suite. It's a really good cross-section. And also, there was questions that we've never seen asked before in anything like this around resilience, that people who have cancer can actually be a massive asset for the workplace after they've gone through their cancer journey. So on areas like that, it's really important we got an understanding. And also on the absence, again, we've never seen any data around absence, so it's really good that we've got that, and you'll see that as we go through this afternoon.
Excellent, thanks, Mark. Okay, so I guess the reason why research has been done is largely based on some of the statistics that you can see within the world of cancer, particularly as what people of working age. And then, Mark, this is a particular focus of yours to make sure that these numbers are highlighted. Would you just give a feel for why this is so important?
Yeah, I do, because again, I don't think people truly understand the impacts of cancer in the workplace and how large it is, and because the amount of absence that people have and the impact, the ripple effect with others in the workplace, it's a lot bigger than people think. So the official number that's been quoted before is 127,000 people of working age get cancer per year, but this is quite out of date. It's 2018 data. the people that, so it grows 1.9% each year, the amount of people who get diagnosed with cancer. And actually the largest growth is in younger people. You can see the 22% growth coming through there. So actually, moving that figure forward, you've got a number now of 160,000. In fact, if you look at the NHS data, it's even higher. It's actually saying it's nearer to 190,000 people get diagnosed with cancer each year of working age. That's from age 20 to 68 with unemployment removed. When you add in the carers, people who are caring for people with cancer of 850,000, you've then got another 900,000 people. I'm sorry, that 850,000 is several years out of date. You've then got 900,000 people living in remission, which again is several years out of date. You all of a sudden get to 1 in 16 people are either diagnosed, caring, or in remission. That's a lot of people. I don't think anyone quite understands how big an impact cancer is in the workplace. So it's really good to have these stats and get them across to people. Yeah,
those numbers really bring it home, don't they? In terms of the numbers of individuals that have cancer, but also caring for cancer, people with cancer, the unseen army of carers to some extent, a really big number. Okay, thank you. Okay, if we just move on to the first part of the survey results, which was really asking individuals what they felt, how they felt, and using words to describe the feelings they had, what they're experiencing at work. And as you can see on the left-hand side there, there's a number of those, and there are in fact the top 10 by number words that we use to describe their personal experience. But also we have some numbers, Mark, on the right-hand side that refers to work and how they felt about whether they felt distracted or not.
Yeah, it's really good to get some data coming through here as well. So the patients that we look after often say that they want to work, and work's saying to them, you shouldn't be working. And that's because people don't really understand what people go through when they go through the cancer journey. So it's really good to see that the patients that, so just on the survey, I probably should have said earlier, everyone surveyed has had cancer in the last 5 years. So this is a really up-to-date survey as well. So that of those people, 33% see work as a good distraction, as a good thing. But at the same time, 22% felt they felt more stressed. So again, they need help from work to be able to manage that. Interestingly, of those that receive good support from their workplace, 47% were saying that it's been really beneficial to them. So again, that's really good. And I know, Kate, you want to add something on this.
Yeah, it is. It's so interesting because it's not uncommon in my experience for an employee suffering either with cancer or any crisis in their personal life to see work as a good distraction. But as leaders of an organisation, that's a very difficult thing to manage. So we want to hopefully always do the right thing. But bringing a person into work, either in the office or remotely, whilst they're going through perhaps what is a very arduous programme of treatment, can be a very difficult thing. And sometimes just because the employee wants to work doesn't mean they should. So as leaders, we always need to make sure we get the best medical advice from professionals who are supporting that individual to say what is feasible, what's real for them to do right now. Is it 2 hours a week? Is it 2 hours a day? Is it 1 week in 4 around their treatment schedule? We rely on that advice to come in and help us do the right thing by that person. It's not always what they want to hear, and that can be a really difficult thing for leaders and managers and HR to support that person on. There are lots of factors like what type of role does the person do. So if it's a role that is largely desk-based or could be done from home, it might be quite easy to accommodate them doing a few hours work. If I use a really extreme example, if they were a long-haul pilot and they were only allowed to work 2 hours a week, surely then a long-haul flight would be completely out of the question. But could the employer find some other way that they could add value in that time so they still feel connected and looked after by their employer? So it's a very complex web to manage, but I think with a strong manager, HR and medical trio, it should be something that can be accommodated wherever possible.
Okay. And equally, this is kind of supplementary to the points already made, really. It's about returning to work and how people feel and how they're able to cope. I know, Mark, this is something that you really wanted to highlight.
Yeah, we've heard this anecdotally for a number of years now of patients that we're looking after, that they say once they've gone through the cancer journey, they feel almost like a different person, and they feel they can offer work even more than they did before. So we wanted to ask around this, and we believe it's the first time anyone in the UK has actually asked these type of questions. And I think it's really good for employers to see that actually it's worthwhile bothering to really help someone through the cancer journey, because the people who do go through it, 59% say they've got a better appreciation of life having experience working with cancer. 50% have got greater empathy and a better ability to relate to others, and 28% feel that they can cope with stress a lot better than before. These are all good things. I mean, you obviously don't want anyone to have cancer, but it's good that you've got people who've gone through it, and they can give so much more back to the workplace. Kate.
Yeah, I'd agree. Clearly, for anybody experiencing cancer, either directly or in a loved one, it's a life-changing experience, and it can really alter for that individual what their priorities are and what really matters to them. I think what I've seen as an employer is that where an employer has the opportunity to do the best they can by that person, the engagement with that individual, the warm feelings that they have towards their employer can massively change. So that's a double-edged sword, right? If we do a great job, that employee might look back and go, they really looked after me. They did the best they could. My employer did a great job. Conversely, they could also say, they really let me down. I don't feel so warmly towards them now as I did. And I've seen that so many times in real life. It just takes a few small things for an employer to do for that person to feel that we truly care.
Thank you. Okay, so moving on, cramming this in, there's lots to get over today. We looked at absence as well, and really tried to better understand how people were able to work whilst going through various stages of their cancer journey, from pre-diagnosis through to treatment and beyond. And Mark, there's some really interesting numbers that came through, really illuminating information.
Yeah, it is. Thanks, Sean. So we've now know what the average is, and obviously, look, everyone's cancer journey is different. Some people this could be a few days. Some people it could be significant. Could be hundreds of days. But we now know the average, which is 15 weeks, 75 days. So that's a lot of time that people are having off. And also, we asked them the time they're having off. We think it actually might be greater than this, and that there might be unofficial time off as well, but this is the amount of time that people are actually having off. So when we do another survey, we might drill even further into that. I think it's and it's good to have the phases broken down as well. Again, we're not surprised by this, by the people that we look after, but you've got all the way through the cancer journey. This is why it's important that people understand, even from the early stage of symptoms through to diagnosis, and then through to treatment and recovery. You can see all the different time periods that people are having off. Really interesting that the lower earners are taking less time off, and we don't know this directly, but we would assume, because that's the pressure on them to go back to work to earn money again. So we assume that's why they're having less time off than those that are more well paid. Again, it's an assumption. When you add all this up and actually look at average salaries, that's costing the UK £1.6 billion. So it's a significant cost, the cancer absence that actually happens. So yeah, Kate, anything you want to add to this?
Yeah, just to echo your point, Mark, that it's a very individual journey for a lot of people, and the amount of time that they take off will be very dependent on their particular illness, their particular treatment. And as you alluded to, perhaps more challengingly, it may also depend on how much sick pay they have, and if an employer is able to offer more paid sick leave, an employee will of course take that and recover from home in a time frame that's acceptable, and that pressure of needing to return to work for financial reasons is perhaps less.
Yeah, I agree. Just one more point, Sean. Just on this, that it is really important. We're going to come on to it later. That the diagnosis stage, that is so important to get diagnosed as quick as possible. That can be the matter of life and death to people. And again, this is where employees and employers need to work together, especially on those early stages.
Indeed, point well made. So we've got some general tips here in terms of how employers might consider the findings in terms of absence. So Mark, there's a number of tips or guidance or help that you'd advise employers to consider when dealing with people who have absence during cancer journeys?
Yeah, absolutely. And I don't want to do Kate after saying a few words here, but there's some obvious things for any employer to look at. One is obviously offering flexible working, and this could be to the amount of treatment that someone's having, depending on their own particular journey. Supporting teams and managers, and when I look back on my past, I wish I'd known a lot more about cancer and about how I could have helped people. So I think, and I wish I'd gone probably more to HR to talk about it with them when I look back. So I think really supporting those teams, what to say, what not to say. There's certain things you should say to someone with cancer. Often, just a little bit of advice is often use the language that they're using back with them. So if someone's fighting, you can use fight back. If they're not using the word fight, don't mention the word fight. So having all those tips and understanding that is really important. And the last point here is, and something that we're now involved in, is screening and doing everything you can to actually get. The NHS have got some really good screening that's available. So understanding and encouraging people who need to get tested to go and get tested. That's a really big thing an employer can do. If you pick people up stage 1, stage 2, it's a lot better. Also for employers as well, 38% of cancers are preventable. So a lot of them, it's around lifestyle. So again, you can't ask employers to do too much, but again, making people aware of these things, I think can really help. If you're picking people up stage 1, stage 2, you're almost doubling their chances of survival. So again, hence why symptoms awareness, screening, all the things that happen there are so important. And then the pain, certainly in the UK, of going to GPs, it's 3 times you have to go to a GP on average before you get referred. So imagine some people 4, 5, 6 times before they get referred from a GP. So again, they need support doing that, even though sometimes there can be some really clear symptoms. So yeah, there's a lot to look at. Kate, any more tips for employers here?
Yeah, and when I give this some thought, there are lots of tangible things that employers can do. The things that you've mentioned there are absolutely right around flexible working, ensuring that teams, managers, HR professionals are all well equipped to deal with whatever might come your way as an employer. I think the hardest thing to get right, and perhaps this may be the thing that is tackled last because it's more difficult, is the culture. How does the culture of the organisation be one that encourages wellness, encourages openness about these things? I'm very fortunate that I've worked at places where good communications and wellness have been a top priority for the organisation. And it can be things like having screening days in the office, or reminding employees that there's a voucher to go and get a mammogram, or whatever it might be. Not only does that have practical positive results for those who take up those services, culturally it also says, we support this, we're open to it, come and talk to us because we know this is important. And I think that perhaps is the hardest thing to get right, but one of the most important. And I have seen employers do a lot more in this regard. Wellness and wellbeing are really very hot topics for employers right now, particularly after COVID. So I'm pleased to see that there's more being done in that space, but we can always do more.
Yeah, indeed. Good advice, Kate. Thank you. The survey also looked at communication and how employees communicate with their employers. And we have some really numbers that we perhaps didn't anticipate. Mark, there's a number of people here, as the survey says, that just didn't talk to their employer.
Yeah, you're right. I think when you see these numbers, it's quite startling. I think a lot of employers would be very concerned about it. Some people even go the whole way through their cancer journey and never disclose it, and the torment they must be going through as they're doing that. I think, in fairness, I just want to reference the great work that publicists have been doing in this space about stigmatization of cancer in the workplace, because the CEO of Publicis got cancer and realized that loads of other people hadn't come forward in his own organization. So it's great that the work they've done with working with cancer. And I think it's really good to, that we're backing up what they've been doing to say that a lot of people are just holding back. So 55% are not coming forward till they've been diagnosed. So they've been going through all that, the symptoms, and trying to get the diagnosis done. 11% not till they've actually finished treatment. And then you've got 28% of employees shying away from talking to their colleagues as well, which again is a shame, and they shouldn't feel like that. And I often say to people, I think such good strides have been made on mental health. I'm hoping over the next 5 years that similar strides are made on cancer, that people can be talked more openly about it. I think that would make a big difference. I think, as Kate just said earlier about the culture, I think it's really important. I think you have to reflect why are people not coming forward. I think they're worried about their career prospects, they're worried about their income, they're worried about quite a few things. So we've all got a job to do to try and reduce that. Kate, have you got anything you want to add?
Yeah, I think for me, when I look at this data, the question is why. And there could be some really deeply personal reasons why an employee may choose not to share their potential worries about what may be occurring, or even their diagnosis, because it feels too difficult to say out loud, or it's too personal, or reasons that are from within them, that as an employer, all we can do is offer that safe place and hope that an employee would come forward and talk about anything in their personal life that maybe we might be able to help with in some small way. I'm frightened to think that there are employees who don't bring up the fact that they are potentially suffering from cancer, or they're being treated for cancer because they're afraid of what that means for their job. And if that were the case, then I think culturally the employer needs to take a good hard look at their own approach to such things, because nobody should have that fear. I think, Mark, you're absolutely right with your reference to openness at work, particularly around mental health. I think about all the great steps that have been taken forward with Pride networks and the phrase of bringing your whole self to work. And this is just another step on that journey, that people should be comfortable, if they choose, to discuss this in a working environment. So I think we've got a way to go, but we are getting there.
Yes, indeed. Thank you. So I think to some extent you may have touched on this, Kate, that developing the dialogue at work and opening up the cultural channels. Anything you want to pick up on here, Mark, in terms of the role that employers can play?
Yeah, I think so. I think that Kate's done the culture. I think it's this thing about early, because as I said earlier, if you pick people up stage 1, stage 2 cancer, you're almost doubling their survival rate. It's really encouraging employees who've got concerns. It could even be concerns about, it could be hereditary cancer, concerns about symptoms, for them to come forward at a very early stage and go and do something about it. I think that is so important, and screening, testing, all these things are really important. So it's not about after people are being diagnosed; it's almost too late. So it's doing a massive change, as we just alluded to, as with mental health, that we're talking about it, we're being open about it. I think that's really important. So there's lots of benefits for employees by doing this, and by working together. Reducing stress, enabling the focus on the treatment. That's a massive, because some people could go through surgery, radiotherapy, chemotherapy, and immunotherapy. They could have all 4. That's a lot for someone to cope with. Some people have more than one cancer as well, so they might be going through 2 different lots of chemo. This is a lot for people to cope with. So the more work can take any pressure off them, I think it really helps. And I think also that this ripple effect, that for every one person affected, you can have another 50 impact in the workplace. So again, if people are seeing that work are taking this really seriously, that's going to really improve morale, it's going to improve engagement, and you're going to retain people. So all the reasons on here. Kate, anything to add?
Yeah, I think your point is really well made around stress and anxiety. Obviously, anyone suffering with cancer is going to be stressed and anxious for those medical reasons. And as an employer, sometimes they may have preconceived ideas about what your employer is going to say, and they may have made up their own story in their head about how that meeting is going to go. When you can get the opportunity to sit down with someone who explains their very difficult situation, and we can say to them, right, This is how long you're going to get paid for. This is what I'm going to do to help you. These are the adjustments I can make for you during your treatment, and a myriad of other things that are specific to that person. In my experience, generally they come away from that meeting hopefully a little bit more assured than they came into it. So that early conversation with HR or your manager can hopefully drive a positive outcome with regards to how that feels. I guess one thing I would also add here is perhaps some of you listening and watching us today are managers, or you lead teams, or you're in HR yourself. None of us, maybe a few, none of us are specialists in supporting people with cancer. It's an incredibly personal and complex journey. And for most of us, sadly, we've got our own experience of cancer in our personal lives, so it can be really triggering for some people as well. So as an HR professional or as a manager, when an employee comes to you and seeks help and support and empathy with their cancer journey, that can trigger all sorts of difficulties for that person. So I think having a service like Reframe, who are specialists, would be a really welcome addition for any manager or any HR professional who without doubt are going to be doing the very best they can. They're not specialists, none of us are. So I think anything that we can do to equip our managers and our HR professionals to handle this very difficult situation better is a good thing.
Yeah, thanks, Kate. Incidentally, our last webinar was on sensitive conversations, and there's some really good advice. If you'd like to check out our website, empathy and sympathy and the differences between the two, really helpful to pick up on the point that Kate's just made. So check that out if you need additional information or guidance on that. Brilliant, thanks, Kate. The survey also looked at benefits and whether the benefits stood up to the needs of somebody that was going through a cancer journey. I know we're all aware that employee benefits are widespread, but do they really support the individual who has cancer? Mark, over to you.
Yeah, thanks, Sean. Again, slightly worrying numbers here that 77% of people felt that their employee benefits didn't fully meet their needs through cancer. But then we step back from it. I'm actually not that surprised, because most companies now have got some form of EAP. As far as I know, and I know pretty much most of the EAP programs out there, there is nothing on cancer support in any of those EAP programs. There's some basic support, but not cancer support, which is specialised by cancer nurse specialists, as Kate has just said. And then you've got an increasing number of people who earn less, feeling that this just isn't working for them. You've also got even people on PMI. People assume that PMI covers cancer support as well. Some PMIs cover some areas of cancer support, but most PMIs focused around treatment. So some of them don't even do diagnosis. And again, I'm not sure, I've now spoken to enough HR teams, some don't understand that. I'm sure most people listening in do understand that, but that level of support is really crucial. And when you go through the whole cancer pathway, having someone who can support you all the way through is quite unique and something that we do. So that's what's really important to get across. And you've got 11% of people plan to leave their employer because they felt the employer just didn't do anything to support them through their cancer. That's a lot of people leaving, and some of those people are young, they're middle management, and they've worked with the employer for quite a few years. They're the sort of people you probably don't want to lose. So again, I think just from a financial viewpoint, it's worthwhile that employers really look at this area. Kate?
Yeah, I think, I try to look at the data and try and understand the difference between people who feel they haven't been supported from a tangible perspective. Did they not get enough pay? And maybe in some cases, an employee might not be entitled to anything other than statutory sick pay, which is unlikely to cover all of their outgoings. Did we not support them sufficiently with time off or make enough adjustments or any of those things? Those are the very tangible things that perhaps are in an employer's gift, but some, like pay, may not be. Where we can have the most leverage is how we make them feel. And I think, Mark, you called it earlier the ripple effect, which I like, and that links very closely into employee engagement. If we do the right thing by this one person who is suffering with cancer, the colleagues that are around them see and hear that we're doing the right thing. And that person will come into the office and go, oh, Kate in HR has been great, Mark's been super, they've really looked after me. And it does have a ripple effect of doing the right thing. It makes people feel more engaged with an employer and more likely to be open about their own situation, whatever that may be, whether it's cancer or something else in the future. So no positive actions ever go lost, I think, for an individual in this circumstance.
Indeed.
Thank you. Okay, and also the survey considered, amongst other things, that the impact on perhaps lower earners, the people that are earning less than average wage, which is about £30,000 a year, give or take. Mark, there's some really interesting stats that come through on that.
Yeah, exactly. And in a way, it's not surprising, but cancer affects everyone the same. Whatever level of salary you're on. So it's not good to see that the lower earners are coming out and saying that there's more of them feeling that they didn't feel supported. 58%, which is not good. You've obviously, I'm not surprised about this, that a few of them have access to PMI, but they deserve to have access to something. And navigating the NHS isn't easy. Certainly, for everyone, pretty much, you're getting cancer for the first time, you do not know what to do, and you do need some level of support to get you through each stage and to actually speed that up as well. So I think that's really important. Lower earners are taking less time off, and again, we're hypothesizing that's because the pressure for them to return to work financially is really, really strong. And then lower earners are more likely to leave due to a lack of support as well. So no one really wants anyone to leave. So again, you're seeing the stats on that on the slide.
Okay, thank you. Clearly an area for focus. Okay, so what do we highlighting? What would we say to employers in terms of tips to review for how they support employees via their benefit? Mark, I think there's a statement here that we sign up to.
Yeah, I totally. This isn't just about looking at the Disability Act or looking, from a technical viewpoint, how you help people through cancer. It's actually doing more. But I think hopefully that the numbers from the people on the survey have demonstrated if you do this, you'll retain more people, you'll keep more people at work, the ripple effect we talked about, all those things. So actually, by thinking a lot deeper into how you can support people through cancer, you're going to have a better workplace by doing that. Kate?
Yeah, do you know, there are so many facets of the HR offering that could touch upon cancer. So the obvious one would be the sick pay policy. And as I mentioned before, some employers don't have a sick pay policy at all other than statutory, whereas some employers I've worked at would pay full pay up to 6 months, dependent on service and things like that. So that can be a huge factor for anybody in experiencing long-term absence of any kind. You've then got private medical insurance that you mentioned, Mark, which may or may not fully cover the cancer, the requirements of treatment. And in fact, some individuals, regardless of their PMI, may still seek and receive excellent care quickly through the NHS. So that's a difficult decision, I think, for some people to make. Often the private medical insurance schemes have got helplines for employees to ring to seek for some medical advice, which can be useful. You mentioned earlier employee assistance programs, Mark. There's critical illness insurance, which can be either paid for by an employer or as a flexible benefit for an employee to pay for. Occupational health providers. There's a myriad of things that we can do, but I guess my question, and I reflect back on my career in HR, is do we all know what those things are? And if, God forbid, an employee were to say to me tomorrow that they've been diagnosed with cancer, would I immediately be able to say to them, right, this is what I'm going to do to help you. These are the services that we've got. I don't know that I would. I think that's something perhaps that, given the numbers you've described today, we all need to get a bit more fluid at, sadly, but we want to do the right thing.
Brilliant, thank you, Kate. Okay, you touched on a little bit of private healthcare there. The survey also looked at private healthcare and access to it. Mark, there's some numbers here that are very interesting.
Yeah, so at the end of the day, 63% of employees are going to the NHS only, 31% are doing both, and only 6% are using private only. This is obviously around treatment and diagnosis. I'm going to pick on the 31% initially, and I think this is something that's not well understood. If you've got PMI, you might have cover for treatment. A lot of them will cover you for treatment, and not all treatment. Not many of them cover you for diagnosis. So if you've then got to navigate between both. We're seeing a big trend now of people working out the one area of treatment they can bring forward is surgery. So often patients are getting diagnosed in the NHS. They're then having surgery privately because they might be able to bring that forward 3 or 4 weeks, which can make a big difference. Then they're going back to the NHS for chemo because it's so expensive. The problem is the NHS is not connected to the private healthcare system in any way. And every time you go back to the NHS, you go back to the start. That's the way the NHS works. So this is a massive impact on those 31%. And that, as I say, it just isn't understood until you're actually in that space. We can really help as navigation experts, helping people manage that, because, and this is where you do need help. That is a nightmare for people trying to manage that. And obviously, you've then got the people that, you know, C-suite obviously getting more PMI than those lower down. But even those guys are not fully covered in the way that they probably think they are. And that's why you need to think fully about the support that you give people in excess of what's on PMI.
Thank you, Mark. Okay, so tips for employers. You may have touched a little bit of this, Mark, I think, in what you've just said, how navigation is so important in terms of being able to move from NHS to private, for example. Anything else you want to pick up on this particular one? Yeah,
there's a few bits of detail on here. So just so you know, if people are with the NHS only, the NHS have a 62-day target. Now, that is really slow, certainly compared to most countries. If you compare the UK across Europe, we're one of the worst, sadly, on cancer. Our mortality rates are one of the highest in Europe. That's a real shame, and you wouldn't expect that unless you knew that. So the NHS, unfortunately, is struggling with cancer. The 64% of patients meeting that target has been pretty flat now for almost 2 years. It's not showing any signs of improvement. So, you know, you've got 36% of people not even being met within the 62 days. That's a lot of people. So people who are going through the NHS need a lot of help. That's really important. As it says bottom left, that's why you need navigation experts to help you manage that and take people through. Just so you know, on average, we are helping people by 14 days improve the speed going through. It doesn't sound like a lot, but that can make a big difference for people.
Thank you, Mark. We're closing in on the end of this webinar now. Essentially, there's lots of information within the research, and we've skimmed the surface here today to give you some highlights, to hopefully give you some actions and some guidance. But we've kind of tried to summarize it into 5 key points that we hope will help you maybe apply it, think about it, perhaps. Mark, over to you on the key areas of focus.
I'm going to let Kate do a bit more than me here, but you know, the open communication is key. And I wish, you know, when look back on my career, I'd done more there. Reviewing the benefits, do they meet what you think they do? This thing around flexible working, understanding when people can and can't work. I mean, often, just so you know, we often work with people to help their especially when people are going through chemo. They can potentially work 3 days a week and have 2 days off. So you can actually get into a really good routine when you're going through things like chemo, and if the people that want to work and can work, it really can help them do that by a lot of good planning. And then the 2 on the right are really important for me. This thing about picking up cancer really early through prevention, screening, symptoms awareness is really important. And secondly, the early part, the early stages, that's you know, if you're going to pick one time to help people, you can really help them at the start. That's going to make such a difference to their cancer journey. Kate?
Yeah, I'd echo that. There's 2 thoughts I have when I look at this long list of things that employers can do. One is a phrase that I learned in a previous employer called shadow of the leader. So at a C-suite or exec level, we need to be encouraging our leaders to say and do the right thing to cascade that culture of openness and support and well-being throughout the organisation. It's the most effective way to spread the word about doing the right thing. And secondly, an example that I wanted to share with you all today, in a previous employer, they brought in a specialist in skin cancer detection into the office. I think it was referred to us through either our broker or our private medical insurer. And they booked a meeting room, and as an individual, you could just go onto their calendar and book a 10-minute slot. Bit weird going into a meeting room with the curtains closed and having your skin checked. But it was hugely beneficial. It gave comfort to those who were checked and were told everything looks fine, had a look at your moles or whatever. But I believe there were 2 or 3 people who were referred for further tests, either privately or on the NHS. And for one of those individuals, early stages of skin cancer was detected. They got very early treatment. And for me, that felt like a sliding doors moment. It made an enormous difference to that one person and everyone in their life that loves them. And it also brought some awareness to everyone else who went. It spread the word. It made people aware that pre-screening was important, and that as an employer, we supported it. So that was a really positive experience that I took from a previous employer, and would definitely look to do something like that again.
Thanks, Kate. Yeah, there's lots of little opportunities like that. We just need to search them out and find them, I guess, in terms of integrating that into normal work practices. Thank you. So coming to the end, just to summarise here, that the full report will be emailed to the people registered on the webinar today. It's also available online just for download, so check out the Reframe Cancer website and it's there, but we make sure you get a copy of that. Just to finish off really, I mean, Kate mentioned it earlier, if you are personally affected or this webinar has triggered some concerns or worries for you, then please get in contact. We will help you. Our nurses and cancer support managers are available to support if you need that. And secondly, if your organisation does need help and support, then get in contact. We can rapidly take care of individuals at whatever point they are on their cancer journey. So if you do look for that, then reach out and we will take care of that for you. But finally, just to say thank you to Mark and to Kate. It's an important thing we've done here, we think, and it certainly isn't the last survey that we'll do. We've unearthed a few things that will hopefully help employers and the workplaces, but more broadly than that, and certainly opened our eyes to some of the findings to help us determine how we support individuals too. So thanks for listening today, listening and watching. We appreciate your time, and please get in contact if we can help you on any of these things. Thank you. Thank you.
Thank you.